Welcome to the press briefing today. Today, the doctors we have are Dr. Chang Shuk Kwan, Head of Communicable Disease Branch of CHP, and Dr. Sarah Ho, Hospital Authority Chief Manager. Dr. Chang will give us an update. Good afternoon. Yesterday, the Public Services Laboratory of the CHP has confirmed 1,619 cases. All are local cases. Among them, 12 carry the L452R strains, and 1,598 do not carry the L452R strains that is supposed to be Omicron. The remaining 9 cases are still unclassified. This morning, we have some 5,400 preliminary positive cases. Now, for our laboratory, concerning the speed and capacity of testing, some 75% of the cases can have their results confirmed within 24 hours. The 5,400 preliminary cases we have, some of the samples are yet to be delivered to the CHP. Some have been delivered. As the laboratory, we have some 4,000 samples, most of which were delivered yesterday. For those delivered the day before yesterday, most have been confirmed yesterday. Some are still unclassified. Some 650 cases are still unconfirmed. They are cases or samples from the day before yesterday. As a result, we have redeployed our manpower, and we have sped up the procedures and extend the operating hours to cope with the need. We want to have the samples confirmed within 24 hours. As a result, we have communicated with the hospital authority. All samples tested by the hospital authority will not have to be confirmed again. The HA's testing service is of high quality. We haven't seen any false positive results from the HA laboratory. As a result, no confirmative test is needed. That's the situation right now. Now about the residential care homes for the elderly. We are investigating the situation at some RCHE, and we are quarantining some of the staff and patients, including the Jockey Club at Tien Yi Ling RCHE, One Ho Gun RCHE at Changzhou North, Christian Family Service, Shanglei RCHE at Kowloon Fuk Tong Road, Kowloon Tong, and Sham Shui Po Fuk Chang Estate, Gui Mei Lin Lok Yi Gui RCHE. That's a day care center, and Baptist Oi Kwun Social Service Lok Kwun Center, Hong Kong Christian Methodist Church, Sham Shui Po Daycare Center, Shing Kong Wui Yuen Wei Yang Home for the Elderly at Chang Kwan O Po Lam Road, and Yun Chai Hospital RCHE at Lei Pui Street, Shackley in Kwai Chung. In a moment, Dr. Sarah Ho will tell us about the arrangements for people yet to be sent to quarantine centers or isolation centers. Confirmed patients may have to wait for a substantial period of time before they are admitted. During the wait, please keep maintaining personal hygiene and environmental hygiene. Please keep your hands clean and mind your coughing manner to reduce the infection risk within the family. If the situation allows, it is better for patients to stay in an independent room, close the door, and use a separate toilet and avoid face-to-face meeting with other members. If the patient has to leave the room, he or she must wear a close-fitting surgical mask. Now, in terms of the environment, you should keep the windows open and use 1 to 40 ratio 1 to 49 diluted bleach to clean the home. Do not share the bathroom. If you have to share the toilet, after every use, you should cleanse and disinfect the toilet at once. And you should regularly pour a half a liter of water into the floor drain. During the wait, the patient and family members should stay at home. That's all for me today. Now, Dr. Sarah Ho will tell us about the HA situation. Good afternoon. At present, there are 2,482 confirmed and preliminary confirmed patients under treatment in our public hospitals, North Atlanta Infection Control Center, the CHP's Infection Control Center, and the AWE Community Treatment Center. We also have 1,700 patients under isolation at the Penny's Bay Isolation Center. So far, 8 confirmed patients are in a critical condition. For the preliminary confirmed 3-year-old girl we have mentioned yesterday, she is still hospitalized at the Children's Hospital in a critical condition. In the previous day, before the midnight, we have 233 patients discharged. Now, the utilization rate of isolation beds at the public hospital has reached 90%. That is the upper limit of our capacity. In the past few days, we have reiterated we have to concentrate our manpower and resources of the public hospitals to give priority treatments to patients in serious conditions, elderly people, and children. For younger patients with a stable condition, we are grateful for their patience, and they have been waiting at home. We would like to say to these patients, we haven't forgotten any one of you. Every day we are coming up with ways to support them. Up ahead, we are going to roll out more measures to support them. Like we have mentioned yesterday, we would open a hotline to give support to patients waiting to be sent to isolation. The hotline is up and running. That's 1-836-115. Between 8 a.m. to 10 p.m., the hotline will be in operation 7 days a week. For those who have been confirmed and waiting to be admitted, and you can call the hotline for inquiry. The hotline is for preliminarily positive patients to inquire about healthcare and infection control issues. Our colleagues manning the hotline will provide support to the patients. And as we have mentioned yesterday, we have 7 designated clinics to deal with COVID-19 patients. These clinics will be commissioned tomorrow. Treatments will be provided to patients who have received notification of preliminary positive and waiting to be treated. For those patients who have mild symptoms like coughing, sore throat, or mild fever, they can get treatment from these clinics. Patients have to make a booking via telephone. This is to avoid gathering of people at the clinics. The medical staff will provide appropriate treatments according to the clinical condition of the patients. If necessary, we will refer the patients to hospitals for further treatment. The operating hours of designated clinics are 7 days a week, including public holidays, from 9 a.m. to 1 p.m. and also 2 p.m. to 5 p.m. Concerning the addresses and the telephone numbers. I have already passed on the information to the reporters at the press briefing. After the press briefing, we will issue a press release concerning the details. I would like to stress that these measures are for provision of support to patients who have been preliminarily confirmed with stable condition. During the wait at home, you have to pay attention to your health. If you have fever, you should take your body temperature every 4 hours. If you experience a sudden deterioration of symptoms, for example, a high fever or unconsciousness, family members should help them seek help from A&ED. During the wait, patients should pay attention to the infection control measures as mentioned by Dr. Zhuang. Once again, I would like to thank our frontline medical staff. During this period of time, they have been working very hard to provide help to our patients. Still, we are finding more ways to provide more support to the patients. Please appreciate our difficulties. We are very eager to provide help for every patient.
Today, we have over 100 staff members who are preliminarily confirmed. Most of them got infected in the community setting or household setting. About 30 staff members will be listed as close contacts. In addition, upon admission screening, 10 plus patients have been found to be preliminarily confirmed cases. About 60 plus patients who shared the same wards would be regarded as close contacts. Our colleagues are now collating the information. Later on, we are going to provide the information in our press release. Thank you. The floor is now open to questions. Please use the mic we pass to you. Please tell us the media organization that you represent. The one in the middle in white. I'm from TVB. Good afternoon, doctors. In relation to the designated clinics, regarding the preliminary cases, does it mean that if you see that you are a confirmed case with your test kit and you will go to the clinic, how many places will be available? Is it a matter of first come, first served? And then how many cases have to be double-checked before you can confirm that they are positive cases? What is the ratio? And then do you have other means to expedite the work? If there are, well, what are you going to do? Are you going to get mainland colleagues to help you to double-check the results? And then with the hotline in place, how many people have already made inquiries? First of all, let me talk about the hotline. Well, it was only yesterday that I made an announcement, and then the hotline was only commissioned today. I think in a few days' time, we are going to watch the utilization rate, and if necessary, we'll make adjustments. As to the question of designated clinics, as I have mentioned, what we intend to do is that, first of all, please call the clinics to make an appointment. In this way, we can avoid having clustering of people waiting for the service. And then they are preliminary confirmed patients. If they have got symptoms, we can provide treatment to them at such designated clinics. For the hotline as well as the designated clinics, well, if you have got questions about infection control or medical issues, then you can call the hotline and ask questions. If you are a preliminary positive case and you've got symptoms, if you want to get treatment, then you can make a telephone call to book an appointment at one of the designated clinics, and then we'll provide treatment to you. While you're waiting, of course, you have to observe your own conditions. As I have said, should there be any changes, say, for example, if your conditions deteriorate, then you may have to go to the A&E department. Well, regarding previous samples, 500 to 1,000 samples are sent to us by the hospital authority for double checking. We'll watch our progress to see how we are going to expedite the work. The lady on the left-hand side in a beige jacket. I'm from cable TV, doctors, for the Asia World Expo. Do we have a separation of the elderly people as well as other confirmed cases? For the medicine wards at hospitals, I think the utilization rates have gone beyond 100. There are patients who have to receive treatment in outdoor settings. This is most unsatisfactory. Dr. Ho, do you have any means to ease the difficulties faced by patients waiting for treatment? For the 7 designated clinics, what is the capacity? How many preliminary positive cases can be attended to at the 7 clinics? Thank you. Well, probably you must have already noticed that the pandemic is aggravating. For patients waiting for treatment, the number is rising sharply. At our A&E departments, in order to separate the general patients from the suspected cases of COVID-19, we have already provided triage areas in the outdoor areas of our hospitals. There are tents so that we can deal with the suspected COVID cases. For elderly patients as well as patients with special needs, we do provide the assistance that they need. We'll try our best to attend to the patients as quickly as possible. You mentioned the case of designated clinics. For the time being, there are 7 in different districts. They will open from 9 a.m. till 1 p.m. with an hour's break. It is expected that we can have a quota of about 1,000 places for advance booking by the patients. Of course, we'll be watching the utilization, and then we may make adjustments in the light of the needs of the patients. Sorry, speaker is off mic. The total. The gentleman in blue. I'm from Now TV. A few questions. Now, you have got designated outpatient clinics. But what about patients who have attended at one of the outpatient clinics? They got recovered. Does it mean that they still have to be isolated and then they have to be confirmed by a doctor that the CT value is up to the benchmark and then defined as a recovered patient and to be fully discharged? And after visiting an outpatient clinic, patients may be discharged and go home. What about those who have to be admitted to hospital? So what about the logistics, about the trips to and from the clinics? Today, mention has been made about deploying a taxi fleet. So does it mean that such patients will take public transport or they will be transported by such designated taxis? And then today, some medical doctors are saying that the figures announced daily may not actually reflect the true picture. So, Dr. Chuang, yesterday you talked about thousands of preliminary positive cases, but today the figure that you gave us was only 1,000 or so. So, what is your comment on the suggestions made by the doctors concerning figures? Well, first of all, let me take the question about the figures. Yesterday, I talked about thousands of cases. They were only referred to us yesterday, so probably the samples were only sent to us yesterday. For the samples sent to us the day before, most of them have been dealt with. The backlog is about 600. So we are not able to confirm their status within 24 hours. Yesterday, our laboratory received 4,000 samples. I think we can finish checking their status tonight, thousands of them. There are thousands of them. Of course, they exceed the capacity of our laboratory. We're resorting to different means to expedite the process and increase the manpower and working overnight to see whether we can catch up and try to confirm the status. So the figures were as I have given to you.
We understand that there are many confirmed or preliminarily confirmed patients still waiting out there in the community. That's why we have set up telephone hotlines. Previously, we have the PSCC support call. Our colleagues would call patients in waiting. We understand patients want to have questions for us, so we have set up a hotline solely for this purpose, for answering questions relating to the COVID-19. And for patients with mild symptoms, they need treatment. Out of concern for our capacity, they did not go to ANED. So we will set up these designated clinics to provide treatments, provided that they have made an appointment. In terms of taxi fleet and the logistics, the THB will be responsible for that. For patients with mild symptoms, according to experience, after receiving treatment, patients with mild symptoms can continue to wait for admission. However, if the situation is found to be serious, as the consultation at the clinics, they would be arranged to go to hospital. So will they be sent to hospital via the transports arranged by THB? Yes, the THB is arranging for this. Now, the testing arrangement, if they have recovered, if they are found to have recovered at the clinics, will they be allowed to go, or will they have to get a confirmative CT test? Well, we have an established mechanism for that. We understand that there are such cases. We will discuss with the CHP on how to deal with these cases. Next question, the lady in a white jacket. Good afternoon, independent media. Now the HA is overwhelmed. The facilities are full. So will the patients staying at home not get a chance to be treated? Now there is a hotline to provide support. What about medications for patients staying at home? Tomorrow, the HA will implement the vaccine pass arrangement. Staff has to be vaccinated before going to work. So for those medical staff who are not vaccinated and without medical proof, how many are there? As mentioned before, we have not forgotten any patient who is still waiting at home. In the past few days, we have been coming up with measures to support them at home, so I am not going to repeat that. About the vaccine pass, as mentioned before, we continue to encourage our staff to get vaccinated. Most of our colleagues, over 98% of them, have been vaccinated. For individual cases, our human resources department will continue to follow it up. Next, the lady here, RTHK. This morning, Caritas Medical Center and Port Oil Hospital have seen people waiting outside in queues. Elderly people had to wait in an outdoor setting. That is undesirable. So why the situation is so bad, and how you can speed up the process? About designated clinics, you said patients may be referred to hospital. So what is the criteria in deciding patients would be sent to hospital or back home? And taxi fleet, what is the arrangement? As I've mentioned just now, the situation is very serious. There are a huge a wave of patients going to the A&ED. We would separate general patients and patients suspected to be COVID patients. At outdoor settings or places with good ventilation, we would set up tents for separation purposes. For elderly people or patients, needy patients, we have reminded our colleagues to pay extra care to them. As the triage point, we would give extra care for these patients. About designated clinics, we have issued clinical guidelines. The guidelines were come up by different specialists and pediatricians and infection control experts. We have worked out protocols for treating the patients. Considering the condition of the patients, say if the patient requires medication, after giving them and if they require further treatments, the THP would follow them up. If immediate hospitalization is required, then we would arrange transport for the patients because there is such an immediate need. So the ambulance would send them to hospital. Next, the gentleman over there. I'm from Ming Pao Daily. Good afternoon, doctors. For several days, we have been asking a question. We wonder whether CHP or DHA know the exact number of patients tested preliminarily positive and waiting at home. In the past few days, the figure was just an estimation. So can you give us the exact figure? Or if not today, can you give us the number tomorrow? Now, can we arrive at the figure by deducting the number of patients discharged and patients deceased? For patients waiting to be hospitalized for a prolonged period, how do they know whether they are supposed to go out to get treatment? Now, in Singapore, citizens are allowed to go out if they are tested negative after the rapid test. Can we learn from them? And 2 fatal cases were announced. Why did the situation worsen so quickly for these 2 cases? Is it because of the delay in admission to hospital? Now, as the AWE, we understand that some elderly people were tested positive, but still untreated. So how would you follow up these elderly patients as the AWE and control the infection risk? Now, for the deceased patients, these cases would be dealt with by the coroner to find out whether the cause of death was COVID or otherwise.
The next one. About the number of people. Do you know how many are patients who have been tested positive and still staying in the community? For the time being, we have got 5,400 preliminary positive cases. We're still in the process of communicating with them. In other words, they have not been admitted. As to the other figures, I don't know them. Are you going to give us such figures? Because we've been concerned about that for a few days already. The gentleman on the other side, from Phoenix TV, this morning, the CEO said that the Queen's Hill estate will have units being used as isolation facilities. Some tenants have already collected their house keys and they are about to move in and furnish their flats. So do you have any infection control measures to prevent the spread of the infection? And what about the monetary losses suffered by them? That is, if they choose to stay in their own flats and not move in and they have to pay for an expensive rent. Talking about no longer accepting HA samples for double checking. By how much can you improve the speed of your processes? And what about the assistance provided by the private laboratories? There are people who have been waiting for 4 or 5 days before they get the results of the test. Is it because of the problem with the private laboratories? Well, every day, the HA used to give us between 500 and 1,000 samples for double checking. But of course, if there are many cases in the community, then the figures will go up. I was giving you the previous figures. As to the case of private laboratories, for the time being, test results from them will still have to be double checked by us. If the figures rise sharply, like going up to 10,000 or so, we may have to rethink as to whether there's a need to change that arrangement. For individual patients, if they go to a CTC, there is a community testing center, they get tested and yet they don't get the results timely, then I think it's a matter of the pace of work of the operators of such CTCs. I think my understanding is that people don't get their results too late, then perhaps it is a matter of the means of contact, like the telephone number left with the operators. As to the other question, I don't have information. Let's have an English question.
It's from TMHK English News. First question to Dr. Chuang. Can you tell us whether the number of confirmed cases nowadays actually reflect the actual COVID situation? Because the preliminary positive cases just keep piling up because of the test delays. What more can the CHP do to speed up the testing on that front, apart from not requiring retesting from HA samples anymore? Second question regarding the designated clinics. How would authorities assess the infection risk to the community when COVID patients come out and visit these designated clinics? And can you tell us concretely, like how will they be traveling to these clinics and back home? Will they be taking public transport, or there will be later arrangements that will be announced later regarding designated transport? And would you recommend people who test preliminary positive to go to these clinics as long as they have symptoms, or would you still recommend most people to stay at home? And with just 7 clinics running for now, handling around 1,000 patients a day, do you think that's enough to handle all the demand with so many cases, preliminary cases still waiting at home? Thank you.
I will first explain the numbers first. So I think most of the preliminary positive cases are coming from yesterday, because yesterday I said that there were 4,500 preliminary positive cases. So the number confirmed last night, yesterday, reflects the number submitted the day before yesterday. So the day before yesterday, we received more than 2,000 numbers of specimens, and then we completed all the, more than 75% of the specimens, and around 600 have not been completed, the test. So for yesterday's specimen, there are more than 4,000. So our laboratory is doing the test. Hopefully it can be completed by tonight, but I'll report it tomorrow. So we are, in view of the increasing number of specimens and preliminary positive cases, I understand our laboratory has redeployed manpower and try to streamline all the process and working long hours to try to meet the demand. So also we have liaised with the hospital authority to there's no need for hospital authority to send their specimens for our confirmation because their laboratory, quality is very good all along. So hopefully we can meet the demand.
For the designated clinic is for those symptomatic, is open for those symptomatic preliminary positive or positively confirmed cases that are waiting for admission to either hospital or designated isolation facilities. So they need to make a pre-registration and booking through telephone, and so they can arrive separately. And we have both software and hardware. For the hardware, we have a ventilation system and additional HEPA filter, so to ensure the ventilation within the designated clinic reach the infection control recommendations. And then for the workflow, and we also separate the patient arrangement, and also we have enough PPE for our staff. So both software and hardware we have prepared for with the consideration of infection control mechanism. And for the symptoms, it's open for those patients that have symptoms. But if the patient have mild symptoms, that can be controlled by paracetamol, cough medicine, and then they can monitor the condition and stay at home. But for those patients, they have symptoms, but they don't have medication at home, or after telephone consultation or telephone inquiry, they still want to see the doctor. The designated clinic is the way out.
And can it satisfy the demand? Just 1,000 patients a day, like 7 clinics around the city.
So we will continue monitoring the usage, the booking, and the workflow, and then we will refine and adjust the service if there is a huge demand.
And how will people be traveling? And what about the infection risk to other people when they're traveling to the clinics?
As far as I know, Transport Department is thinking the logistic. I'll leave them to answer the question later.
I understand that the government is trying to arrange designated transport.
So there will be designated to and from the clinics?
I don't have the details yet, but we are thinking along this line.
Good afternoon from the SCMP. Dr. Chuang, we understand that Chief Secretary John Lee's foreign domestic helper and lawmaker Regina Ip's driver have tested positive for the virus. So will there be special treatment to expedite confirmation of their test results, or will they be treated like everyone else? Would you recommend high-level officials with close contacts who test positive to stay home and attend meetings virtually? And then my other 2 questions are for Dr. Ho. With an increasing number of hospital authority staff infections reported, how much has this affected hospital services? And there's been photos online showing people waiting outside hospitals for treatment. So how is HA handling the situation? With such a backlog in admission, what do health authorities suggest patients at home do if they test negative after a few days? Are you still going to admit them? And if yes, isn't there a risk of cross-infection? And I'd also like to ask, what is the average turnover point for patients in Penny's Bay? So essentially, like, how long do they stay there on average before they're discharged? Thanks.
I do not have information on individual cases, but in general, if your close contacts of possible confirmed case or confirmed case, we advise you to stay home until we contact you.
We observe there is a huge demand. Patients arrived in A&E. So that's why we segregate some area outside the indoor area. So in order to protect some protection, we separate those patients are not COVID related for emergency consultation and those with preliminary COVID result. So we try to provide some protection by setting up some tent to have shield for those elderly and also those patients in need. And at the same time, we are trying to increase. I understand the government is identifying more community isolation and treatment facilities. So hospital authority is preparing the manpower, and then in case there is such a setup, we will go there to support them. And I also want to emphasize the designated clinic is for those confirmed case with symptoms. So if they have symptomatic, they can book the designated clinic through the telephone on telephone to make an appointment.
Do you have how long usually patients stay in any stay before they are discharged?
I don't have the data on hand.
下一位嗰邊後邊嗰位女士。
Next question, please, the lady over there. I'm from Hong Kong 01. Recently, many symptomatic patients who were tested positive with rapid antigen tests, they cannot get the deep throat saliva samples, bottles. So what can they do? Should they go to A&ED? And now the HA is under huge pressure. Now you have designated clinics. Some people just rather stay home and take Panadols or Chinese medicines. So would you endorse this arrangement? For patients feeling unwell at home, if they have medication at home which can alleviate their symptoms, and if they continue to monitor their health, they do not necessarily have to make a booking at the designated clinic. The clinic is for symptomatic confirmed patients who require treatment. Next, the gentleman in green. Good afternoon, AM 730. Just now, Dr. Ho said the triage station would provide preferential treatments for elderly people and people in need. So for confirmed patients, can they be accompanied by the family members? And do you have any mechanism to avoid people going away? So for preliminary cases at care homes, would you recommend them to go to the designated clinics, or should they go to A&ED? And Dr. Zhuang said most of the cases were confirmed within 24 hours. However, we were told that many cases did not receive the case number for many days. So if these cases have turned positive, with affect their treatments because they can't go to the A&ED. And how many people at the HA are away from work because of the infection? And what's your plan to deal with the shortage? About the preliminary positive cases, we would contact the preliminary patients and arrange for admission. The case number is just a formality. For preliminary cases, they would be given a number already. They can make an inquiry with the HA. And the HA would treat all preliminary positive cases, so you do not have to worry about this. At A&ED, we would separate general A&ED service users and other COVID patients. Because of the sheer number of patients arriving at A&ED, for patients with stable who are stable, they would be asked. We would ask them to wait outside where air ventilation is better. For elderly patients, we would do our best to give them more care. Now, for those who accompany others to seek treatment, we hope family members can accompany the elderly people to seek treatment and give them more care. About manpower, there is definitely a huge impact on our manpower situation. we have extended invitation to part-time medical staff and those working in the private sector. For medical staff in the private sector who would like to help, they can reach out to us through our locum office. The lady over there. Good afternoon. I'm from Hong Kong Economic Times. Today, we have some 100 HA staff members confirmed. Now, it seems that we have more than 200 HA staff infected. Now, are there any urgent operation procedures or treatment procedures have to be delayed or referred to other clusters? Now, about the designated clinics, since there are many HA staff infected, will the designated clinic have to close if any staff are confirmed? And what about infection risk control? We see long queues outside testing centers. So despite the telephone booking system, we may still see long queues. So we should consider an online booking system for patients who were tested positive after an antigen rapid test. Can they still make a booking? Now, the authority is doing your best to increase the quality of facility and speed up the admission procedures. We were told by people at Penny's Bay they haven't received any testing after being quarantined. So what is the testing arrangements and the discharge or isolation arrangements for those patients? And what about the treatment? Many questions. On designated clinics, they are for confirmed patients with symptoms. For patients who are feeling unwell, they can make an appointment via telephone. So we are also concerned about infection control. That's the purpose of the telephone booking system, for reducing the queues and reducing the infection risk. Inside designated clinics, there is a standard for ventilation, hardware, say partitions, and a workflow. We have given due thought in designing these workflows and designs. The infection control standard is well thought out. So for AWE, we would only discharge patients who fulfill the discharge standards. For HA staff who have been infected, would it affect the operation of the AWE? As mentioned, we have non-emergent services which we have scaled down because of the situation to spare more manpower for urgent operations or urgent cases. So this is the strategy that we are adopting so that the urgent operations will not be affected. The last question, the gentleman over there. Good afternoon. We are told by members of the public, some patients are living in subdivided units. They don't want to infect their family members. That's why they are lingering on the street. And they think it is okay because they are not making contact with anyone. It shows how many patients are there in the community. So would you advise these patients to stay at home? So what would be the consequence if they breach your requirements? Now, Mr. John Lee, his foreign domestic helper has been tested preliminary positive, so he has attended the executive council meeting today. So what about the risk for other EXCO members?
Attendance.
For confirmed cases and preliminary confirmed cases, we hope that they will stay at home before being sent to a community isolation facility or a hospital. I won't comment on individual cases. That's it for today's press conference. Thank you.